Now, doesn't it seem as though so many people around you have been getting sick lately? The U.S. is getting hit hard with what experts are calling a quad-demic: COVID, flu, RSV, and norovirus. According to the CDC, ER visits have been high for flu and RSV, and for norovirus, it's at its highest level since 2019. Doctors say it's typical for these viruses to go up in the winter months, but what's been especially concerning, though, is the rate of increase for these viruses. So joining me now is Dr. Natasha Bhuyan, National Medical Director of One Medical. Why are these viruses skyrocketing?
Yeah, all of a sudden. Well, for COVID and for norovirus in particular, they both underwent some viral mutations recently. So if someone had a prior infection, they're no longer as immune as they were before. And so we're seeing cases rise. All these viruses are very highly contagious. And especially in the cold, dry winter months, viruses spread really easily because they're kind of encapsulated and it makes them more durable. And so it's the perfect recipe for all kinds of viruses right now.
Yikes. Okay, so let's tackle each one, starting with norovirus, because I feel like that is what so many people have been talking about. So what exactly is it, and what can you do if you have it?
Yeah, so norovirus is essentially a stomach bug. So it causes things like vomiting and diarrhea, and it is very resistant. It can live on surfaces for days, and even when you wash laundry, it can survive. Typical household cleaners don't always work. Hand sanitizer doesn't always work.
Which is very troubling when I read that.
And so what ends up happening is when I see one person with norovirus, other people in the family often get infected, but there's a couple ways to prevent that. Number one, make sure that you are washing your hands thoroughly, especially before you eat. Scrub under your fingernails. I tell people use household cleaners that have bleach or hydrogen peroxide because those work better. Of course, cook your food thoroughly. Make sure you're cooking seafood. Wash those fruits and vegetables. And when you're washing laundry, wash them on the hottest cycle for the longest time because we don't want other people in that house getting sick.
Okay, and is that something that lasts a day, couple days?
So norovirus typically lasts for about 3 days in most people. People who are immunocompromised, it can be longer. But the problem is, even if it lasts 3 days in someone, they can still spread the virus even when they've recovered. And so I see kids get it, and then all of a sudden their parents get it.
It wipes out a family.
It's a whole family. And so you just, if you're worried about your kids having a stomach bug, just make sure you wash your hands, use that bleach, really disinfect as much as you can.
Okay, next up, flu.
Yeah, so flu is also something we're seeing an increase of. Hallmark of flu symptoms is people tend to get symptoms really quickly. So body aches, fevers, cough, people can often pinpoint exactly when they got sick. There are rapid flu tests at home, so you can always take that if you're worried about the flu. Now, I always tell people at the first sign of a cold or flu, make sure you take some zinc. It can help shorten the duration of a cold or flu, which is a great thing to just have in your cabinet.
I do that because of you.
It works. It really does work. There's research that shows. And then the other thing is, rest, hydration, those are the things that help with the flu ultimately. And a lot of people get a lot of mucus during the flu, and so making sure you use a humidifier to break up that mucus.
Yeah, and blow your nose. That's what I tell Zach. Blow your nose.
And the nice thing is if you do have flu, there is an antiviral medication out there if you need it.
Okay, next up, COVID.
Yeah, so
it's not over yet.
It's not over yet. It's still around there. The hallmark symptom is the loss of taste and smell. Of course, we've got home COVID tests, so people often know if they have COVID. If you do have COVID, you can call your doctor because now we're able to prescribe those oral medications for it over the phone. And so pretty easy to treat. And of course, if you have it, stay at home, wear a mask if you're around others because it's very contagious.
And over-the-counter meds, we're talking what, Tylenol?
Yeah, Tylenol, ibuprofen for fevers, like all of those work fine.
Okay, got it. Okay, lastly, RSV.
So RSV is pretty unique because in typical adults, it seems like a cold, but in kids and in older adults, it's much more severe. It can cause wheezing and shortness of breath, a lot of congestion. Kids who have RSV, sometimes they just don't want to eat at all. And so if you're worried about RSV, definitely worth getting tested. One of the things I tell people for RSV is it causes a lot of nasal congestion. So if people use nasal saline drops or a neti pot, you can actually rinse out some of that virus. And so using nasal saline drops if you are worried about RSV is a good trick. A lot of people, kids sometimes get hospitalized for it. So if you see a child with difficulty breathing, don't hesitate to reach out to your doctor.
Okay, excellent advice. Good to know, what to do once you have it.
Yes, stay safe because it's out there. These viruses are everywhere.
Yeah, we're feeling it in the newsroom and at home. All right, Dr. Natasha, thank you so much.